Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is travel medicine. Joining us today as our guest speakers are Vilha Drelichman, with the of the infectious disease, and now she's practicing travel medicine clinics with the Beaumont Corwell Health Center. Also joining me as a guest speaker is her associate Linda Johnson. She's the office nurse with the travel care, and she has had a 22 years experience of working with Dr. Drelichman. So good morning, Vilma.
Good morning, Dr. Prasad.
So can you give your introduction to our viewers?
I'm Vilha Drelichman. I'm an infectious disease physician. For over 40 years, I had a big practice of infectious disease for many years, like I mentioned, and I just retired this year. However, on the side of that clinic, I also founded travel care to take care of patients traveling all over the world to prevent diseases. So I was section chief of infectious disease at Providence for all those years. Recently, I passed my section chief to Dr. Rushda Malik, an excellent infectious disease in my group. We are 10 infectious diseases that are dedicated to take care of patients in the hospital and also outpatient. Our group goes to Ascension Novi, Ascension Providence Southfield, as well as Corwell Health. We have different offices around the city. And I was invited today by Dr. Prasad to discuss about travel care and to give them some information.
Thank you so much. Linda, what do you have? Give your short introduction.
Okay, my name is Linda Johnson. I've been a licensed practical nurse for 41 years, and out of the 41 years, the last 24, I've worked with Newland Medical Associates.
With the best person.
Yes, with Dr. Drelichman, who is a wonderful infectious disease doctor, and she's a very good friend.
Yeah. So starting as a first question from you, Vilma, will you please explain about the travel checklist, what everybody, we
Sure.
all go outside the country or inside.
I just want to mention what is travel medicine first.
Sure.
It's a specialty that is dedicated to take care of
Right.
people, individuals that are traveling all over the world.
Right.
And practically to prevent diseases that may encounter or outbreak that they may encounter in those countries. Keep them healthy while they are on vacation.
Sure.
Travelers in general are thinking that they are going to find a beautiful thing, beautiful, good meals and different people and everything,
Right.
but they are not really, they are without regards of the things that they may encounter. There are many diseases that we can prevent. So that is what we have been doing for 24 years.
So that's good. You are doing a wonderful job.
Thank you.
And then, like we go outside the country very excited, we're going to eat and what we are going to do.
Right.
But we don't think about what is ahead of us, going to the third world countries or
Right.
even in the, the rural areas of United States. There's so many, hidden diseases that we can get exposed to. So, will you kindly share the travel checklist?
Yes.
With the travelers
I
when
will.
we go? Yeah.
So the impact really of travel medicine is prevented different diseases through vaccines, through advice. And we usually, when we see our patients, we have a checklist, and we actually prepare a folder for our patients so they can read, and they can also take it with them on their trip when they can, again, consult on their folder to see what else they can do to prevent diseases. So we ask them to get informed and to register with the travel state government for their destination. That way they will receive information from the government to see what's going on in that country. They will get information on their cell phone. They will tell them what are the advisory from the government for that particular country that they are visiting. For example, they give them different levels of safety. So level 1 usually is go, you can travel without any problem. Level 2, they have to exercise certain caution when they go to these countries that they are having problem, and then reconsider travel in level 3, and level 4 do not travel. So all our patients that come to see us in travel care, they go through that and they register with the state, the government. So that's one thing that we do. Another thing, we tell them what are the things that they can encounter. And we go over, Linda will go over their vaccination record, which is we obtain usually from the Department of Health. Yes.
Yeah.
Okay?
Yeah. So that basically there's a whole good list of travel check-in
Yes.
that you provide them, which is such a good information for
Yes.
them. Yeah.
Yes.
Now, do you have anything else to add with what she has said?
Yes, typically on the checklist, as she said, we recommend that they travel, they register with the U.S. Department of State, but also to see your primary care doctor to make sure that you're physically healthy
I was
to
going
travel.
to ask you. I was going to ask you. Very important, right?
Very important.
Yeah. And then you want their immunization list and everything.
Immunization list, medications to make sure there's no drug-to-drug interactions with malaria or antibiotic therapies that may be prescribed. Yes.
Yeah, we are going to come to it. So now, will you please tell me what are the challenges and the impact of travel?
Okay, the challenges are because patients are maybe not aware what's going on in those countries.
Right, yeah.
The other challenges is that maybe the insurance that not cover the certain vaccines or the consultation. And that's sometimes difficult for the patient to understand, but we try very hard to get the insurance to pay for their consultation and the vaccination. We do everything possible to get. We only, we accept insurance, and we try first for the insurance, and if they don't, then we will send the bill to them later on. And our patients are familiar with that very well.
Yeah.
The other thing that we usually check is their underlying medical problems. For example, if you have a patient who has coronary artery disease, we will ask them to see the cardiologist, to ask them to request a copy of their last electrocardiogram to take them with that. And those are patients that may have history of coronary artery disease, maybe they have atrial fibrillation. We are concerned about people taking, for example, anticoagulant, so those patients may need to check the INR during their travel state. So we usually recommend those to take care of that. We go over vaccination side effects, and we make sure that they understand that, and we give them, Linda usually give them the list of vaccine that they will need according to their MICR, the Michigan Immunization record and registration that they do. So Linda can talk more about that if you think it's important for you.
I did a lot of reading, research on this because, I wanted to know more about travel medicine. The CDC guidelines, they have a good protocol about what immunizations accordingly. Yeah. But what I request you guys to tell me, how about the other rare diseases, like you go to Africa, you go
Yeah.
to third world countries,
Yeah.
you are exposed to yellow
Yeah.
fever, the encephalitis,
Yeah.
tick-borne. So what precaution measures our viewers should take
Right.
when they are going to those areas?
So, like I mentioned, we take care of people that maybe have coronary artery disease, maybe people who are taking anticoagulant. We also check on patients that probably already have no access, it's difficult sometimes to find health care in those countries.
Right.
And then we go over all the vaccination that they may need. There are countries that may need yellow fever. There are countries that may not need yellow fever. And also we go over what vaccine is important for them. There are many diseases now, including here. We have seen cases of dengue. Dengue is a viral infection
That was my another
transmitted
question.
by mosquito. And so there was a case reported in Florida that a lady died from dengue fever. So, but we see it more frequently in South America, Brazil, Paraguay. All those countries have dengue fever, including Asia has dengue fever. Okay, so Africa has dengue fever. And so dengue fever, we don't have any medication. It's self-limited. We usually ask them to drink a lot of fluid, to take bed rest, and to pretty much, they go away usually the first. Dengue doesn't, it may make you very sick, but most of the time they are able to get out after 4 or 5 days. However, if you have a second dengue, that is more serious because they may develop what we call hemorrhagic fever, and hemorrhagic fever sometimes can cause death, and that is more serious. Now, we do have the dengue vaccine that was just recently approved. However, it's only recommended after the first episode of dengue diseases. Yeah, the disease. So to prevent, the hemorrhagic fever with the second episode, that is the more serious one.
Then you give them the
Right.
vaccine.
The other disease that they may encounter is chikungunya, and chikungunya is similar to dengue. Chikungunya give you a lot of body ache, joint ache, and you walk like a chicken. You cannot, really walk straight. And there is a vaccine now, just recently approved as well. We have it in our office now, in our refrigerator for the vaccines. We have chikungunya vaccine. It's available when you are going to travel to areas where they are seeing dengue and chikungunya. What else do we do beside that? We have other vaccine for yellow fever.
Yeah.
That is recommended. They have actually the age usually supposed to be safe for people up to 60 years of age, but some patients who are very healthy, we may give them at 65 as well or at 70. Depending on the high risk or low risk, we will modify that.
So, Vilma, I was going to ask you, plague is eradicated from the world, but occasionally I see the CNN report, that there's somebody coming from South Africa and they have plague. So do you see anything? Is there any preventive measures for those kind of thing, or just the vaccine is good enough?
Yeah, plague is very rare now.
Very rare.
Yeah.
No, smallpox.
Yes, yes. We hardly don't see that right now. I think the last case that I remember reading was in India, where they have plague.
That's where it started.
Yes,
from
exactly.
India.
Right. The other thing is obviously. We have other diseases, we have malaria. We give them prevention for malaria.
Malaria itself is a big chapter when I was doing my studies and research. Malaria, falciparum, vivax. The one which is more dangerous is is the malaria falciparum.
Yeah, right. And there is different places. You know, India, for example, they have more malaria vivax,
Right.
and Africa has more malaria falciparum.
Falciparum.
So, and another thing is, there are other diseases, obviously. You know, with yellow fever, you have to be very careful, you know, just...
Yeah, what you said.
So now with the yellow fever vaccine and
Yeah.
the chikungunya vaccine, those are live virus vaccines.
Yeah, yeah,
So
you
a
have to be
person who are
careful.
immune compromised must be aware of where they're traveling. And that's where the importance is of coming to a travel clinic
Right,
arises, because persons that are severely immune or immune incompetent cannot take those particular
Right.
vaccines. But we offer the service of, like Dr. Drelichman said, to review their health and then review their itinerary, because even though it may be listed as a yellow fever risk country, they may not necessarily need the vaccine because the risk is very low in that area. And so we give a comprehensive evaluation when they're there, and then we review them. On rare occasion,
Yeah,
we have
yeah.
had to advise persons
There's
to
always a
reconsider.
rare occasion.
Yeah,
Reconsider
we've had
the
to
travel.
reconsider travel to that area
Area,
because
right,
they
yeah.
can't take the vaccine and it's too high of a risk for them health-wise.
Yeah.
We also go over the safety of food and water. So
Right.
we usually recommend our patients to only drink bottled water,
Yeah,
because the
okay.
bottled water is purified.
Yeah, right.
And we ask them not to not to put ice in their water or in their drink.
Yeah.
We
Very important,
ask
no
them
ice, yeah.
to brush their teeth with the bottled water, and
No raw vegetables.
yes, the food has to be hot. They have to be well cooked, their meat, and because obviously those also can transmit other diseases. And with milk has to be pasteurized. Cheese has to be pasteurized because you can get also disease like listeria. There was just recently here in the United States an outbreak of listeria from the meat, you know, lunch meat. And so those are the things that we said. Fruits they can eat, but only those fruits that
Only
have
those that,
thick
right,
skin
with the
that you can
shells.
pay, like banana,
With the shells,
oranges,
yeah. Well protected, yeah.
Thick-skinned fruits.
Thick-skin,
No,
pineapple,
yeah.
mango.
Yeah.
Yes, correct. And we go over and no
insect.
strawberry, no berries, no blueberry,
Yeah.
because those you cannot peel. So
Right.
we go over food safety as well.
And insect precautions, that's the big one.
Which one?
Insect precautions.
So
Oh,
to
yes.
avoid mosquito bites.
Repellent,
So
yeah.
we instruct clients on wearing unscented toiletries, washing their clothes and unscented laundry products, and then the various insect repellents. 30 to 50% DEET, oil of picaridin, oil of lemon eucalyptus, and even pre-treating your clothing with
Yeah.
permethrin before you go.
Correct.
Yeah, right, yeah.
So it's a whole consultation, but patients usually walk from our office very happy.
With
and,
happy, full of knowledge.
Right.
Now, one last question. Could you comment about what are the group of medications they should take with them?
Okay, so we
There's
recommend...
a whole list in the CDC.
So what we recommend, for example, because we have to try to prevent travel diarrhea, okay? And travel diarrhea is caused by E. coli.
Traveler's diarrhea.
It's a gram-negative, it's a bacteria that over the years became resistant to ciprofloxacin, which is the antibiotic we used to use before. Why did they get resistant? Because we were using, I think at that time, telling them to take it before they leave, continues taking every day while they were there. So overuse of ciprofloxacin caused resistance. So now we don't use any longer ciprofloxacin. We use Citromax, which is azithromycin,
Citromax, yeah. I
and we
saw
ask them
that.
to take that as directed. We ask them to first take Pepto-Bismol or Imodium with the first and second episode of diarrhea. On the third episode, then, to use azithromycin, and if they see blood in the stool, to proceed nearby hospital, because that means it's
Right.
getting more serious.
Yeah. How about Bactrim sulfa? Before I used to prescribe. Is Bactrim not used anymore for the UTI, persistent UTI?
Now for UTI is different. This is for travel diarrhea.
Traveler's
Yes, E.
diarrhea.
coli,
Yeah,
right.
okay.
Yeah. Okay.
And there are medications in the event they're doing mountain climbing.
Yes, high
Yeah, right.
altitude.
I was
So-
going to ask you about mountain climbing.
So we
yeah.
do prescribe, or Dr. Drelichman prescribes acetazolamide, which is
Acetazolamide.
Diamox
Yeah.
for high
Diamox,
altitude prevention of acute mountain sickness.
Yes, there are patients that are climbing and they are going, even if they go to Cusco, it's very high altitude. Machu Picchu, Peru is
Machu
high
Picchu, we have been
it's
there,
lower
yeah.
than Cusco, but still, we have to give them, and if they go
Diamox.
to Ecuador, they have high altitude, we give them Diamox for.
So
for-
Diamox, when you prescribe Diamox, do they start taking it before couple of days?
The day
because
before.
you cannot
The day-
just abruptly start
Yeah.
and take and stop, right?
The day
The
before.
recommendation is the day before, every 12 hours, and then you
After that.
stay
For
on
a
it.
couple of days, and
Every-
then Diamox.
Yes, some patients may develop numbness of their finger and their toes. So
Okay.
we recommend that they can decrease the dose, maybe
Small?
cut
Small
cut
dose.
the pill in half until the numbness goes away, and then go back to the one every 12
Yeah,
hours.
okay.
So there are ways to manage that.
Yeah, when we went to Machu Picchu, I felt so sick, at the
I
high
know.
altitude.
Right.
But they recommend oxygen, right? All the rooms were equipped with some oxygen.
Yes, there are.
Wherever
yeah.
we
In like
stayed.
Cusco, they have that too,
Yeah, right,
If you
yeah.
if you need it, and if they are in high altitude, what we recommend the patient is to descend, to come back down. So that also
Oh,
will help
okay,
them. Yeah.
okay. So
And we make sure that they don't have any cardiac conditions or other problems that may affect their health. Other things that we do is when you go to developing countries, anywhere in the world, you are going to encounter hepatitis A, hepatitis B, and so we
Hepatitis
make
B.
sure that their vaccine are
Yeah.
up to date. And Linda is in charge usually of the vaccine. After I finish the consultation, she takes them to the next room where that we have only for vaccines, and she
Then
can
you
tell you
go.
what she does with those hepatitis A and hepatitis B. Obviously, hepatitis B is not food related; it's related more to blood,
Right, blood
exposure,
and, yeah.
secretion exposure,
Injection, drugs and all those,
exactly.
yeah.
So go ahead, Linda.
So typically, when a person comes in front of us, we review their standard immunizations because things like measles, mumps, rubella, varicella are very
Right.
important. Tetanus.
Tetanus,
We find that a
yeah.
lot of adults have not continued with their tetanus, diphtheria, pertussis.
Right.
So when you come to see us, we will look at your immunization record and bring you up to current standard immunizations, and then get into the travel vaccines such as typhoid, yellow
Typhoid.
fever,
I was
Japanese encephalitis.
And I was, Japanese encephalitis, I just read about it, so interesting.
Interesting.
But how about COVID, post-COVID? Do you recommend?
COVID
like,
vaccine, there is a new strain of COVID.
Newest one, the one
Yeah,
that
there is a new strain of COVID vaccine from Moderna and also from Pfizer, and it's
Moderna,
highly recommended now
Pfizer.
for this season. So we should all be getting that
Yeah.
because COVID. COVID could be very serious for people of our age, for people who has underlying diseases,
Yeah.
immunosuppressed, and so on. Yeah.
So no matter what you had before during COVID epidemic, still you need to be boosted up with a COVID vaccine, right?
That is the
Because
recommendation.
it mutates, the virus mutates, changes its name, and then it goes to affects the lungs. So I think we covered everything. Is there anything?
Yeah, I just want to mention that we actually live in a global community now because
Yeah,
we have a
right.
lot of people traveling here and there. And obviously, if you have a disease in India, maybe you are going to see a disease here.
Right,
That because people are going to see their family and now coming back. Just recently, you
Carry
probably
with them.
heard
Yeah.
that in New York they have a case of polio, and
Right.
this young man came from his country, you know, and he was given the polio virus active, the live polio virus vaccine. And so when he got to New York, he transmitted that to another person.
Yeah.
So the nice thing we have here in the United States, and I think it's also around the world, is that they practically follow and analyze the wastewater, and
Right,
so they
yeah.
know exactly and if there is polio virus in the wastewater. The same thing they did it with COVID. So that way they can let the
Right.
public to go and
Yeah.
get vaccinated.
Right, because their relatives come and they bring all sorts of virus, and I
Yeah.
know many friends who came back after travel, long air flights, and
Yes.
came up with the COVID.
But we also discussed that part for the people that are traveling for a long period of time. They take them 15 hours or 12
Yeah,
hours flight
15 hours
to
flight.
prevent deep venous thrombosis, to prevent pulmonary
Yeah.
emboli. We ask them to be well hydrated,
Yeah.
to walk in the aisle of the, and to
Beautiful.
do some exercise with their foot so their cuff is always moving,
Yeah.
and so they don't
So
get
that's
it. Yeah.
good. I'm so happy. I'd like to thank both of you.
Thank you.
Thank you for
And
having
then
us.
what is the keynote? One last minute, you will advise your
Okay.
viewers last minute.
I'll be glad to do that. Okay, I would advise to all people that are attending this important interview, I will say, to be aware that it's not just traveling to different countries. It's important that you can come to the travel clinic, any travel clinic that you are familiar with, and get a consultation with a physician, and then get all your vaccination updated if you
Okay.
need it. If you don't need it, then we won't give it to you, obviously.
yeah.
And it's important to go over all the things that I just mentioned. So the consultation with a travel clinic and somebody who has done this for a long time,
Okay.
I think will give you
Okay.
safety. Thank
So,
you.
Anything you have to add what she said, or is it?
Yes, with your
She repeated,
planning,
yeah.
allow a minimum of 4 to 6 weeks prior to your departure
Yeah.
date. That's so important because the sooner you come in, the better it is for you to develop antibodies or
Right.
immunity to the vaccines that are recommended for you. So the earlier that you plan your
So-
trip and see a travel clinic physician
Better.
would be better for you.
So your
I
antibody is at that
So
level.
I like to thank our viewers for watching this very interesting topic, travel medicine, with our guest speaker Vilha Drelichman and Linda Johnson, the office nurse associate. And I'd like to thank our producers for helping me with this video. I'd like to thank both the guest speakers for coming
Thank you.
to
Thank
my
you.
show
Thank
today.
you.
Thank you.
And I want everybody to have a very safe fall and winter. And when they travel, make sure they go and visit them.
Travel
in the
care.
Travel,
Travel care. Travel care.
travel care. And thank you
Yes,
again.
thank you. Thank you for
Thank you,
giving us
thank
the
you.
opportunity,
Yeah.
Doctor.
Thank you.
Okay.
Thank you so much.